Hi, thanks for joining us today. I'm here with Joy, and my name is
Hi.
Shelise Irby. I'm a registered dietitian, and I met Joy a while back through my nutrition work. But Joy has been working with me for more than 3 years now, getting her heart tested with the heart sound recorder at Dr. Mark LeMay's office in Fair Oaks. And so today I asked Joy to join me in this little video to tell everyone about her experience using the heart sound recorder, getting tested with the heart sound recorder, and how she has had improved health through that process. I have been using the heart sound recorder in the LeMay's office for about that same time,
Yes.
about 3 years. Yeah.
Mm-hmm.
Joy was one of my first people that I got to test in that space. And it's been great that you've been able to stick with me the whole time.
Oh,
It's been wonderful. So Joy, can you tell us a little bit about your experience getting
sure.
tested with the
I
heart sound
really
recorder?
appreciate the help you've given me with the heart sound recorder. It's a real easy thing to do. Everybody should be doing it for their heart health. So
Mm-hmm.
I have been working with Shelise for like over 3 years, maybe
Oh,
more.
yeah,
So we've
more.
been doing a
Mm-hmm.
lot. And when I actually started, I had no complaints or symptoms
Mm-hmm.
from the heart, but I'd known about the work and I thought I'd like to try it. So that's how I got
Mm-hmm.
started with her. And with each session, we could see total improvement on the paper.
Yes.
And some of my symptoms slowly started improving too,
Mm-hmm.
energy wise, breathing wise, which I guess I was having problems with. That was a little bit of a problem I had.
Yeah, it was when we first started, for
Mm-hmm.
sure.
Mm-hmm.
Yeah, when we first started testing Joy, she had a lot of stress from work, a
Mm-hmm.
lot of fatigue, some challenges sleeping, things like that, getting enough rest. And we could see it in her heart. So, if you're not familiar, the heart sound recorder is pretty much a very specialized microphone that can listen to the heart sounds. And so, similar to a stethoscope, but it can hear sounds that the human ear cannot hear. So, it's a little more advanced in that aspect. So, what the heart sound recorder does is it listens to the sounds of the heart and then it turns them into a graph
Mm-hmm.
so that I can then read it and interpret it and recommend certain nutritional or lifestyle changes. So for Joy, when we first had her scan 3 years ago, there was some flutter in the valves. A couple sounds were missing in certain sections, and we also had some sounds that weren't necessarily tall enough. Right, the heart wasn't as strong as it needed to be for the type of energy and lifestyle that Joy wanted to have.
And now with today's recording specifically, you can see
Mm-hmm.
tremendous. We'll show
So
you on
much,
the graph that
yeah.
the levels are
It's
cleaner and
so improved, yeah. So when you read a heart sound recorder, it looks pretty similar to like an EKG reading. You can see the like lub
spikes.
dub,
Yeah. Mm-hmm.
spike, and we want those spikes to be very clean and crisp, and we want them to not have flutter in between them, and we want them to be evenly spaced. And also, we want them to be tall. Like, really, that's the strength of
And
the
it's
heart.
showing that now through me. In the beginning, there were
Yeah.
some not looking good things.
Yeah, there was some weakness in the heart for sure, and some stress you could tell.
And the test itself is very easy to do. Shirley walks you through it, explains everything that she's doing. She's very kind and passionate about it. So it's not hard to do. And the results are immediate. That's the other great thing.
Mm-hmm.
So she does the test and then she sits there and with her knowledge and expertise will make a personalized plan for you or for me. She did.
Exactly. Yeah. So it's really non-invasive, which I love. I don't like tests that are overly complicated or painful. So it's really takes only about 20 minutes, and then I can look at the graph and interpret it right away to figure out what sort of nutritional needs are important for that specific patient, and lifestyle stuff too. I also recommended a lot of lifestyle changes for you as
Absolutely.
well.
Dietary
Mm-hmm.
nutrition and when she gives you the results, the thing most I like about you is your ability. You have an innate ability to pinpoint the exact, whether it be a vitamin, a supplement, a remedy, to personalize it to the person, just right pinpoint. And you're very good at doing that.
Thank you,
I
Joy.
love that about you.
Yeah, and the more I get to know you, just like Joy, the better recommendations I can make.
Yeah.
So I'm really good with Joy because I've been seeing her for so long.
Yeah.
I know exactly what she needs.
And I plan on keeping up with it. And I really think that the heart sound recorder being a non-invasive tool, along with a holistic approach, we can change heart health.
Yeah.
Improve it. And my heart, thanks.
And your hard work, Joy. It's I do make the recommendations, but it's important. It's all up to you as the patient to carry them out and follow through. And that's what I love seeing. I love seeing someone come in and have a heart scan that's showing a lot of stress on the heart. And then we do the recommendations, and the next time it's like, 50% better. And It's like, oh my gosh, look at that. And usually patients have more energy and, maybe feeling better, don't have that racing heart challenge that a lot of people have. Or
I have also started walking more because I guess because of this test has made me realize how important the heart is. Mm-hmm. And now being retired, I got to work on my heart. Mm-hmm. So I recommend anybody and everybody to at least do the test once and see where you are.
Yes, I think it's very important to know where your heart health is at, especially if you have a family history, right? Mm-hmm. Then you might have some predisposed challenges, and you want to make sure you're getting ahead of those if you can. And stress of any kind is going to be negative for the heart. And lifestyle, it really is a lifestyle disease, heart disease. So it's all about what we're doing and the choices we make every day and the food we're eating and things like that. So that's why it can be super helpful to get the information. So thanks for listening, and thank you, Joy, for being here to tell people about your experience with the heart sound recorder. If you would like to get your heart sound recorder done for you or a family member, I do heart sound recorder testing at the LeMay's office in Fair Oaks every single month. And it doesn't matter the age. I test people of all ages as long as they can sit still and not talk for a few minutes while we're doing the scan. And if you want to get your heart sound recorder done, you can call 916-965-8171 to make an appointment at Dr. LeMay's office to get your heart sound recorder test done. You can also visit LeMay Chiropractic.com or just type in LeMay Chiropractic. So thank you for watching, and we'll see you soon.
Thanks.
Bye. Hi, everybody. So my name is Shelise Irby. I'm a registered dietitian, and I'm here at LeMay Chiropractic and Wellness, where I come and do heart sound recorder testing every single month here with the patients here that Dr. LeMay has. So this is something I've been offering to patients at LeMay Chiropractic for many years now, and I really enjoy coming up here. If you don't know what the heart sound recorder is it's a specialized tool that I use to listen to the heart sounds, kind of like a fancy stethoscope, and it takes those sounds and converts them into a graph so that I can look at it and interpret it from a nutritional perspective of what the heart might need support in. So Mary here, say hi, Mary.
Hi, everyone.
Is someone that I've been testing on the heart sound recorder for a few times already, and she's also been a patient of Dr. LeMay's for a long time. So I asked her to come here today to help explain what her experience has been with the heart sound recorder and just her overall feel of being here in the office. I feel like your doctor is kind of like a part of your family, and it's really important to have that, that not only that personal connection, but also someone who's really able to identify what's going on with you individually. And so, Mary, why don't you tell us about your experience here?
Well, when I first came here, I didn't know what to expect because I just felt kind of overwhelmed in my life. I had so many health issues. I have been injured on the job, and I had an open claim, and all of a sudden workers' comp just said, nope, we're not going to allow you to have any chiropractic care or see any doctor. We're just cutting you off of everything. And I was like, well, what do I do now? So we closed that claim, and the first thing I did was I came here to Dr. LeMay's office, and I was feeling miserable. And when I walked in here, I had all kinds of health issues, and I couldn't even walk by myself. I had to have my walker to support just even walking in here, and I couldn't even walk like 10 feet without having to stop, take a break, and gather my strength back to move forward. When I came in here, it was just such a positive experience. They took the time to get to know me and find out what my needs were. And then Dr. LeMay said, do you want to try the nutrition part? So I said, okay. And I was like, what is going to happen here? So then I did the zinc test, and it's like, you take this little drink and you put it in your mouth, you swish it all over your mouth, and it's like, well, what does it taste like? And for 10 seconds, and then you swallow it, and then it's like, was that the worst thing you put in your mouth, or did you not taste anything at all? Did it taste like pure water or something? And I was like, well, it wasn't the worst thing I ever tasted, and it wasn't the plainest, it had something to it. And I said, I'll give it about a 5 in the middle, and then it's like, oh, good. And I'm like, oh, because I didn't know what's going to happen with that. So anyway, then they were testing with the computer and different things between my medical records and the information they got on the computer. They developed a nutrition program just for me. And so I thought that was really cool, and I was like, is this going to help? And I was like, how was this going to react? And so I started taking the nutrition supplement the end of June, the first part of July. And since that time, I've lost over 45 pounds. And I've had some ups and downs in there, but I was just amazed at how I feel now. And then we decided to try the heart monitoring machine on me. And when I first came in here, I sat down in this chair, and I couldn't get up without any assistance. I was just so tired and everything. And so then she suggested that I take Mighty Mag. And I was like, well, my body doesn't absorb magnesium. And that's when she says that's the type of magnesium that's designed for people that are like me, that our bodies don't absorb magnesium very well. And so I started taking that, and now today I can stand up out of the chair by myself. I don't have to have assistance to walk anymore. And also with the nutrition supplements, Dr. LeMay, it was really funny. He has these different pressure points that he presses on your stomach in different areas for stomach, the spleen, the intestines, and everything. And when he first did it, he said, I want you to tell me what your pain level is. 0 means you don't feel anything at all. And 5 means it's like I'm stabbing you with a knife. And just about every place that he touched me, it was like, knife, knife, knife. And I'm like, oh, what is going on here? And then when we last tested my nutrition supplement, and we went over this again, I had 4 of the areas that were down, and there's 10 different spots that he pokes on. And out of those 10, 4 of them were down to 0 now.
Wow.
So I was so excited because it's like I am feeling so much better. I have more energy, I can get around better, and I just have hope again that I can move forward and not be in so much pain, because I have chronic fatigue, fibromyalgia, repetitive motion syndrome, tendinitis. I have all these health issues that just really just shut me down. And last February, I was so kind of like in a state of depression, and I wasn't even able to get out of bed. It just hurt all over. And so now I can get out of bed without having to like walk out of bed and just stand up. It was just like, oh, it was so painful. And so now I can get out of bed, I can stand up, I can walk. And where before I was just struggling. Basically I was in home and I couldn't even walk from my bedroom to the living room without being in such excruciating pain. And I didn't want to do it because I just hurt so bad, and so many people feel that way, and I just didn't know what to do. And so by taking my nutrition supplements and drinking water, one of the things that I did give up was I'm a Pepsi-holic. I have to have a Pepsi, at least one Pepsi a day, right? So now I switched from Pepsi to Sprite because one, it's not a dark cola, and two, it doesn't have caffeine. And so since doing that, I mean, I'm trying to give up all my sodas, but I'm not quite there yet.
Baby steps, right?
Yeah, baby step. And that's the other thing is, with Dr. LeMay and Michelle and you, it's like everything just baby steps. Don't overwhelm yourself, and that's what I like about it. Is everything has been little stages, and it's just been fascinating. I mean, my skin is clear, and I just felt like somebody just put a straw in my mouth and blew me up, and then it's all woo. So at least now I'm more relaxed, and I feel like there's hope that I can get through all this. And eventually, I want to be able to be where I can go and learn how to ballroom dance.
Oh, is that your goal?
Yeah, that's my goal.
That's fantastic.
Yeah.
Oh my gosh. I love that. Well, thank you so much, Mary. And I really appreciate, you sharing your story, because there's so many people out there, like you said, that are experiencing pain every day and issues with mobility and weight and things like that, and mood. And like you get to that hopeless place where you really don't know what to do.
Exactly.
Yeah. So if there's somebody out there watching this that is, maybe considering, maybe they're in that space, right? Or maybe they're considering trying nutrition or something like that, what would you want to say to them?
I would say, what have you got to lose to try? Because that's the way I felt. Like, I've tried everything else. And when I first started here, Dr. LeMay says, Mary, it doesn't matter what type of health program you want to try, nothing will work because your digestive system is all out of whack. So let's get your digestive system back together. And the other cool thing is that now a lot of my pharmaceutical medications that I was on, I don't have any pharmaceutical medications that I'm taking right now. So I really like that because the more natural that you can take and get rid of all the other medicines that are out there, the better that you always will feel.
Yeah, I would agree. I do feel better when I'm taking my nutritional supplements that are from food, instead of chemicals. So, and for the heart sound recorder, would you say that this is a really easy tool for people to, experience and learn a lot about their heart?
Oh yeah, I've been amazed at just what has happened when I first came in here. You're like saying, well, Mary, your heart is racing like you're doing a marathon 24/7. And I'm like, I don't want to run anymore.
I don't want to run.
I'm tired of running. And so I was really tired, but since I started on the magnesium, and I just feel so much better, and I'm not as tired and I'm not as exhausted as I used to be. So because of what we found out with that and comparing then I feel that that really has been very beneficial for me. So everything in baby steps that we've done along the way has been very positive and very beneficial for me. And the cool part is this is a individual thing. It's not designed for everybody to have the same thing happen, because what your body needs may be different from mine.
Exactly.
And so that's one thing that I really like, is it's a personal need. It's not one size fits all. So whatever you got to lose by trying, you know?
Yep. Everything is about customizing and personalizing. I think that's the most successful way to figure out, you know, how to get your body better. So
and the cool thing, if you try something, I did try, I was having problems with my side, and I wasn't sure if it might be a kidney thing, so I did try a cranberry, and that thing tasted horrible. But it tastes like I'm eating a plant. I mean, as soon as it touched my lips, it was like, but overall, it really helped to clear out my kidneys and my whole entire system, and I felt better afterwards by taking it. So some of these things don't always taste good, but
it's true.
The benefits outweigh the yuckiness for a few moments.
That's good advice too, I think, because when you're helping support your body in healing, it's not always going to be particularly pleasant, but try to make it as easy as possible. Those little tiny course corrections can make a significant difference in where we end up with our health. So thank you so much, Mary. It's been so awesome to get to know you and to help support you in your health goals. So
thank you so much.
So thank you also for watching, and if you are interested in creating a nutritional program with Dr. LeMay here in the office, you can go to the website to schedule an appointment, or if you're interested in doing a heart sound recorder test with me, then you can do that by calling in. So thank you for watching, and we'll see you soon.
Bye, everyone.